Hello, happy February and happy Black History Month in the United States of America. This is Dr. G at the Heart of Healthcare with bonus episode 38. And I have the founders of Heart and Soul Hospice, two gentlemen who are making history today. And we're just going to talk about some of the work they're doing. Hello, gentlemen.
Hey there.
Hey, how you doing?
Hey, it's February, and people know that's my birthday month too. So I have to put that out there.
All right, all right. Happy.
Yeah. And before we go forward, I have to express my condolences, Dave, because your team didn't
Uh-oh.
beat my enemies yesterday. And so I'm not happy about the Super Bowl.
Thank you. I'm putting all of my good hospice grief support experience to work because we are certainly grieving here in the city of Detroit over our Lions.
Oh my goodness, my goodness. You see, I have my little pillow here. I'm not ready to put all my football stuff away yet, but I was rooting for blue. Now we have
Thank
all
you.
that
Thank you.
red.
Yes.
Oh.
Boo.
Boo. Well, I want to first just, thank you two for being here, but I'll let you introduce yourselves. We have Dave Turner and Nathan Yemane. I think one of you is in Detroit, the other one is in Seattle. But I want you to introduce yourself, maybe give us a 30-second bio of each of you, and then we will jump into the show.
Nate, you want me to go
Who wants to
first?
go first?
Go ahead, Dave.
Okay.
Go ahead, Dave.
So
Yeah,
sure,
go
sure.
ahead,
My
Dave.
pleasure. And again, thanks for having us, Dr. G, and thanks so much for all the wonderful work that you do and the great content and information that you're sharing with your audience. So my name is David Turner, and I am joining you from Detroit today. This is my home city. I was born and raised here, and I started my career in hospice here in Detroit. But I no longer own a hospice program here anymore. I actually spend about half my time now in Nashville, Tennessee, where back in 2020 we started the idea. In 2021, started operations for the inaugural Heart and Soul Hospice location. So it's been up and running now for around 3 years or a little less than that. Things have been going wonderful, and the main mission within the mission of Heart and Soul is to help make sure that all folks, regardless of your socioeconomic status, your racial background, or any other identifiers, have full access to information about quality end of life care. It is super duper important, and we really do have a specific focus on the African American community because we are traditionally underserved and underrepresented, not only as patients and families, but also as those in ownership and senior leadership. And so Heart and Soul started in Nashville. And then a year or so into our operations, I had the good fortune of meeting Nathan, who I'm going to hush and let you explain who he is. And he runs and is my partner and opened our second location out in Seattle. So go ahead, Nate.
Oh yeah, that's awesome.
Yes, thank you, as Dave said, Dr. G, for having us and for just the time that we've been able to have conversation and speak with one another. You are a wealth of knowledge and very much an expert in the hospice field, and so I always find it just a honor to be around people like you. Just to give you some background on myself, so I started out in hospice back in 2011 as a hospice social worker, and so and being able to over the years kind of understand the field, but then also understand the needs that exist in the field. Came to the realization that really to address those things, the best thing to do would be to start something that is of my own, or where I partner up with somebody. And right around that time, I developed a relationship with Dave Turner, and he really kind of really taught me a lot of things, showed me the ropes. And so we decided, hey, there's a need in a particular part of country and the Seattle area where I grew up, where my family's from, where my father really did a lot of work in the area, doing community engagement, community advocacy, and really it was a staple, in the area. And so, knowing what I know, and having that social work background that I have, which is to really be an advocate and really to be a change maker in the society and the city that I live in. And so uh, Dave and I decided this is something we got to do. We have the passion for it. We know what the need is. We know how people of color are so underrepresented in hospice, and it really is something that you just don't see a lot of hospices doing work in. And so it just made sense for us to collaborate and start a hospice in the Seattle area. And really, it is a testament of how well and how impactful Heart and Soul Hospice in Nashville has been, because I was able to really see what they were doing and say, we got to do that in Seattle. It just made that kind of sense.
Mm-hmm.
And the people that Dave has assembled in Nashville have been very supportive. Keisha Mason, the executive director there, and so many others have been a lifeline for us here in Seattle, have been very supportive. Dave has just been cheering us on and really become, maybe somewhat of a part-time resident in Seattle too. So, but he waits till the weather's right, because I
That's
don't
right.
blame him. It rains too much out here, so he'll be back out here when it gets a little bit warmer.
Oh,
So that's a little
wow.
bit about me.
I love that. And just he, awesome. And just hearing the name Keisha Mason, that pulls me in. People can see my first name, Keishana. And, I remember being in residency and walking around and seeing the little girl come by with her barrettes or her beads in her hair. And they would just be like, oh my gosh, to see me. And that would kind of change the whole tone. It's really important work that you're doing. And for everyone listening, while we are talking about, healthcare disparities during this episode and health equity, of course, we know that hospice in general is underutilized by Americans. The article that I highlighted in the book, The Real Deal About Hospice, talked about 27% of Americans don't know what hospice care is or what it does. And so that's bleak. And so we are doing our part as Americans to change that in all communities. So I want to point out, Dave, I saw that you were highlighted by the NHPCO last Black History Month in 2023, and I really complimented the team. I think they did a good job of highlighting various leaders around the country who are making a difference in the hospice and palliative care industry. It's nice to reminisce and highlight some of the trailblazers and historical figures who made a difference: Martin Luther King, Rosa Parks, and Harriet Tubman, and things of that nature. But they really did an excellent job of making it relevant so people could see how we are making a difference today, and how other Americans can jump in to help the work, because it's not just work for Black Americans, it's work for all of us to do to make our country more inclusive. So I like what you said here. You said one of the keys to helping our organization increase access and utilization in the Black community has been strategic relationships with historically African American churches and organizations like the National Medical Society and Mary Mahoney Nurses, ... And then it said, we do significant in-reach by being active in local events and supporting Black media. It's vitally important that hospice providers don't just look to take Medicare dollars out of the Black communities, but are also interested in putting money back into them. That's profound. Tell me more about that.
Yeah, well, thanks. I appreciate that. And, I wanted to make sure that that last part of the commentary got in there because, I've been doing hospice now for a little over 15 years. And I can't tell you how often I've been at conferences or meetings and other folks in leadership that maybe don't look like us. More often than not, I'm one of the few, if not only, owners of a hospice program, at NHPCO conferences or other organizations involving end of life. And I can't tell you how many times that folks will come up to me and say, "Hey, we want to get more Black patients. We want to get more Black families to utilize our services." And I tell them that's wonderful. I think that's a great goal to have in mind. But beyond looking to be someone who, again, takes Medicare dollars out of the community, I want you to also consider ways in which you can support the communities in which these folks live in. And so with Heart and Soul, we make it a big focus that, when we spend money on media, we have a wonderful radio show in Nashville on a Black-owned AM gospel radio station. It's every Tuesday. It's called From the Heart. And it's hosted by our volunteer coordinator and by one of my partners in Nashville, who's also the pastor of his own church. So not only and it's not about hospice, it's just about anything that might be on the minds of the folks who are going to be on that week. But what does that do? It helps us get exposure, yes, but it also helps the bottom line of that Black-owned radio station. If we're going to place a billboard somewhere in Nashville, it's going to be in the Black community. I was telling you before we started the podcast, we just wrote for an organization our size a pretty substantial check to be one of the premier sponsors for Nashville's Martin Luther King Day celebration just a couple weeks ago. So things like that, where you're in the community, and yes, you want to get your name out there, but everything doesn't have to make you a buck. Sometimes you should spend a buck just because it's the right thing to do, because you're trying to support those organizations. We also make it a point with Heart and Soul, anytime we're spending money, one of the first questions that Keisha knows to ask is there a Black-owned vendor that does that? So if we're buying, printing or transportation services, or we moved offices at the end of the year, so we made sure that we could identify a Black-owned moving company. So there's nothing in it to gain for our organization other than the fact that we recognize that, like you talked about the yin and yang, you have to make sure that you are putting back into the communities that you are also hoping to provide care for. And that is just vitally important to me. So thank you for asking.
Yeah, that's good. Nathan, I know you're also doing a lot of community work and continuing the legacy of your father.
Yes, absolutely. Yeah. And, one of the things that I try to do is certainly in an understanding that our application to the state, when we first started out to establish a hospice in King County, Washington, that application required support. And we were able to get support from a lot of clergy, faith communities. We were able to get support from historically Black organizations such as the Urban League and the NAACP chapter out here, and also Mary Mahoney Professional Nurses Organization. Also, one other one I'd like to mention is the Mayor's Council on African American Affairs for the city of Seattle. And so, and really maintaining that relationship is important and key. And so, been able to do that by sponsoring events. Whenever they requested for sponsors to put in their program. So we've done that. I have one right here. In fact, I was wanting to make sure to share this. The reason I wanted to share this is because you just don't really see in programs and church programs like this. You don't really see healthcare providers. You see different businesses like restaurants, maybe, or local businesses, but you don't really see healthcare providers. But our information is in here. It gave me pride in knowing that we were able to educate, because it's here it is, but it's an education thing. Familiarity is education. When people see Heart and Soul Hospice, maybe that's the first time I've ever seen something about hospice ever. Maybe that's their initial exposure. Maybe whenever that time comes, the only reference that they have ever of hospice is seeing this program right here. And so I just understanding the need for that, the need to educate the community by just being present, by being there. And that's what we've done is we've been to events and just there to answer questions. We don't have an agenda. There's no propaganda. It's just for people to be able to know we exist. And sometimes I have very brief conversations, and people just come and look at the pamphlet and they say, and they walk away. And then sometimes they want to have in-depth conversations about their own experiences, most times negative experiences with end-of-life care. And so it's really key to be involved. It's really key to be present. And as Dave said, to be able to financially support businesses in the community.
If I can jump in and just brag on Nathan for just a moment, Dr. G. We talk about community inreach. So when Nathan was talking about having to go through the certification hearing process, it was interesting and telling that the other hospice providers that were applying for the same certificate that we were, all of the folks that they had speak on their behalf were people who were involved with their organizations. Ours was the total opposite. Nathan did a fabulous job in reaching out to all of those community-based organizations and foundations so that all of the folks who spoke on our behalf were from the community. So it wasn't just, internal. It wasn't self-serving saying, hey, we think there should be a heart and soul there because it's good for us. No, it was people from the community who support Nathan had garnered before we were even open that said, this is something that the Seattle community needs.
I love that. And I first want to define for the audience because they may be unfamiliar about what we're referring to. So while we're talking about the disparities, there are certain states in our United States that are certificate of need states. And so that is where, well, why don't you guys define what that means for the audience, for people who don't know what that means?
Sure.
Dave.
So yeah. So it varies from state to state, and what you find is there are certain states in the U.S. that say for any particular type of health entity, you have to prove that there's a quote unquote need for another provider of that type of service. It might be hospice, it might be hospital beds, it might be nursing home beds, or whatever it is. And so when I decided to venture out from Michigan, which is not a certificate of need state, when I decided to venture out from Michigan into Tennessee, one of the things that made it appealing is that what you find is that in the certificate of need states, more often than not, the population that we are hoping to, again, bring into the fold, not just as patients, but as, involved in the organization, because certificate of need states have fewer providers. There are fewer options for people. And because there are fewer options, that means that more often than not, fewer people have access. And so we find it to be a more fertile ground for the heart and soul mission and vision for what we do. And quite frankly, in Nashville, where we first started, there was no numeric need for another hospice. So the state of Tennessee has this formulary that they use to say, is there another need for whatever the business type is? There was not a need, but we were successful because we were able to drill deeper into the numbers and say, if you look at these numbers for utilization in general, including all folks, maybe there is not a need, but let's take a closer look at this. And when they did, they saw that, especially in the African-American community and other minority populations, the utilization of hospice at the end of life were so dramatically low that they recognized they needed to do something about that. And that's why we were successful. Washington was a little bit different in that the state of Washington did identify that there was a need for another hospice provider. And so we were able to apply against other hospices that could go for that same license. But I believe, and Nathan, you can speak to this better than I can, that a part of the reason that we were selected is because of our special practice and our special mission. You think that's a fair statement, Nathan?
I think it was a fair statement in supporting everything else that we had said in the application. They made it a point to say we cannot approve a hospice based on work with special populations, but in the law itself, in the state legislation, basically it does say that applicants who work with special populations and race and ethnic minorities are listed under special populations, that their application is prioritized. It doesn't mean that it'll, but all it says is prioritized. So I think it did help for sure.
That's great. That article that I shared with you from Seven Ponds, it was entitled Racial Disparities in End of Life Care, Bridging the Gap Through Education. I really think that the work that you did in the community, helping people understand, the definitions of hospice care, end of life care, advanced care planning, all the things that we know we need. But just breaking down the barriers of communication with education really likely helped, birth Heart and Soul. And so it's really good that you all are doing that work.
Yeah, I mean, I think if we're honest, that
so what I didn't actually.
You okay? Okay.
Go ahead.
I was just gonna say, I said, I think if we're honest, this goes way beyond just end of life care, right? In healthcare in general in the United States, the disparities are very clear and evident. And I think it's wonderful that CMS and other organizations are recognizing that, and they're doing things to help address that. And so what we do at Heart and Soul is we try to carve out our little niche in the space that we operate in, and at the same time try to help folks navigate the entire healthcare spectrum, because we provide care for not just the patient, but it's the patient family unit. And oftentimes, the family is dealing with all types of other issues related to health and finances, and Nathan's work as a social worker and spiritual needs and all these other things that come into the idea of caring for a loved one who is reaching the end of life. So it's a lot more broad and wide reaching than just the care for that person who is unfortunately with a life-limiting illness.
Yeah. How do you all come up with the mission? I didn't have it handy. I'm having a little technical glitch here, but how did you create the actual mission of Heart and Soul Hospice?
Well, I mean, I think it happened organically. I mean, listen, we're both part of the minority community. I'm African American, and Nathan is a little bit of this and a little bit of that. But we so like he said, in his work as a social worker and in my work as an operations and business development guy, I think the mission created itself. We saw a need. We recognized that for some folks. And again, I want to make it clear that Heart and Soul does not only care for Black patients, right? We will provide care for anyone who needs it. I'll give you a wonderful story if we have time. I'll make it quick.
Yes, we do. Absolutely.
Shortly after we started operations, there was a wonderful story written about our new operation in Nashville that ran in NPR. And I was in the Nashville office, and we get a call from a gentleman who was obviously white and identified himself as such. And he said, "Hey, I just wanted to let you know, I saw the article, and I think what you're doing is wonderful and very much needed. But my mother is actually in need of hospice care now, and I would love to have her on your services if that's something that you do, or do you only care for Black folks?" So, we have to be careful about our messaging. Now, we ended up having his mother come under our care. It was a wonderful experience for that family, and I think we've made some wonderful relationships beyond that. But we want to make sure that folks know that we will provide end of life care and education for anyone that needs it. What makes us different is we have a special focus on making sure that we do aggressive, I call it in-reach, because we're in the community. It ain't outreach. When you're there, you're inside, right? That's why I call it in-reach. So we are doing aggressive in-reach to the same extent that other providers are doing in other communities. We want to just level the playing field. We aren't saying that, we only want to do, we want to make sure that everybody has access to the wonderful Medicare benefit that is hospice.
Absolutely. And if we're honest, also, many Americans they request culturally congruent care. Um, I've seen it all the time. You know, my friend over here with her senior father, they're Korean. Like he wants a Korean doctor. You know, over here, you know, if there's a language barrier, people want, you know, someone that speaks their language. And so it is in our best interest to provide, you know, the cultural humility that we should have for our diverse society. And so I want to applaud you for the work that you're doing with Heart and Soul. And obviously, just, you know, thank you for being here. Give you the floor if you want to share any final closing thoughts for Black History Month as you two are making history today.
Go ahead, Nathan.
Now, I just want to say thank you for having us, and certainly, I think just being aware of historically the injustices and the ways in which the American healthcare system has tragically and treated African Americans and other people of color, and coming at it from that standpoint. I feel like our mission and what we're doing is, in a lot of ways, um, we're able to provide care for individuals who've lost a sense of trust in the healthcare system, who they themselves have been and continue to be discriminated against. I graduated from a university where the medical center for that university was built on land taken away from African Americans under eminent domain, right? And so the healthcare system, it doesn't have to be malpractice or anything like that. The healthcare system, has caused injury in other ways, and knowing that something like that has current implications. If I'm the daughter or the granddaughter of someone who lost their home because the hospital took over that piece of land, I might not want to go into that hospital. And so just knowing things like that, and being very directly positioned to see those things really does provide the right spirit for why we do what we do.
That's good. And I think, I try to do my best, with my sociology background to bridge those gaps in communication because a lot of times, what is the new term, BIPOC? So non-BIPOC Americans may be afraid to approach those things. Of course, we have people on the extreme who are anti, but just acknowledging those things, it's sometimes as simple as that, and that breaks down the barrier of communication. And listening to someone share their story can also just bring down that anxiety level and bring the people together, because at the end of the day, I think we want the same things. We want our families to thrive, we want to have good health care, we want to raise our children, we want to put food on the table, and so we want the same things. And so I think it's great that us in the hospice industry and palliative care, our our strength is communication, right? So I love how we can, encourage that in our society with the work that we do. So thank you for that closing thought. Dave, anything?
You know what? I guess the only thing I would add, because I love what Nate said, but I think if I would do anything, it would just be to give a shout out to, because you're talking about Black History Month and heroes, and there are a lot of heroes that don't even get to do things like this. A lot of credit goes to people like Nathan and I, and certainly we appreciate that. But there are countless, especially in the field in our industry, working nurses, social workers like Nathan was, and primarily certified nursing assistants. CNAs
Yes.
are truly the walking warriors of hospice. They see the patients more than anyone else, and in most organizations, I don't care who owns it, they are a great majority of them African American women. And so I just want to give a shout out to all those Black CNAs that are out there doing the work every day.
Yes. Thank you, all hospice aides. And when you said that, a few popped in my head, and
I bet.
they're the best.
Me too.
They are the best, and you know
Yeah.
who you are. And I
Yeah.
thank you for everything that you do. So happy February, happy Black History Month. Um, this is our bonus episode for February, highlighting Heart and Soul Hospice. And we thank you all for joining us. Peace.
Peace. Take care.
Thank you.